Hi again, everyone. I'm Dan Ramey with Media, coming to you from inside the Ross County Health District. It's been a while since we've stopped back for a visit, so we thought we would catch up with Dr. Chris Brown here in just a moment to see where we stand in the way of the COVID-19 pandemic and how it's being handled here locally. But first, this from Hometown Motors Incorporated.
The fleet of American-made stand-ons from Wright Manufacturing, built by landscapers for landscapers. Available now at Hometown Motors Incorporated, 818 Eastern Avenue, Chillicothe.
Welcome back again to the Ross County Health District office. We have with us now the Health Commissioner of Ross County and also the Medical Director, Dr. Christopher Brown. Thank you for joining us here today.
Thank you for the invitation.
We wanted to catch people up to date. Last time we were here, well, gosh, it was around April or so, maybe early May. All these weeks are running together anymore. And so is the information that we're getting from different sectors. Mm-hmm. I know it's different on a national level, it's different on a state level, and of course here locally. We're well over 100 cases now here in Ross County alone. Give us what you can in the way of an update.
Okay. So I think that since the last time we talked, yes, number one, I guess we've had a lot more cases than we had originally. We're actually up to around 130 cases here in Ross County. In addition to that, a lot of the information has changed. Originally, I think when we first talked, I think there was, some confusion about masking. I think there was a lot of information about the surfaces where people were concerned that they would catch the coronavirus through just touching things. There was also, questions about, treatment methods for the coronaviruses. And of course, at that point in time, we really just did not have a lot of information. I mean, this was a brand new virus that was coming to us, and we were just, getting information from other countries, but also trying to see how this virus was affecting the people here, not just in America, but also in Ross County. So.
Yeah, and I know at the early onset of this, we had Italy to look at. We had Korea and China, places who had already become hotspots.
Right.
And I know that had to put a lot of people on alert here.
Yes.
Because we didn't know what to expect, and there was a lot of push for a potential surge. Never really saw that surge here in Ohio, but we did see it in spaces like New York, and now we're seeing it down in Florida as well.
Exactly. You're exactly right. So everyone was preparing for the surge. This was a concern because of how rapidly this virus seemed to spread in other areas. We here in Ohio, under the leadership of course, Governor DeWine, actually shut down pretty early. We were one of the earliest states to shut down, and we really think that is what slowed the spread of coronavirus in the state of Ohio. Kind of like you said in New York, like I said, they were actually behind us in terms of shutting down schools and things of this nature. And as you saw, like I said, there were quite a few cases that were there, like I said, with a significantly higher death rate that was there. So fortunately, like I said, at this point in time, we're starting to see, or I guess unfortunately at this point in time, we're starting to see the virus spread in other areas. And this is following, kind of what we call the reopening phase, where some states reopened a lot faster than say Ohio. I think we had a very measured reopening plan, and so we reopened a lot slower.
Our large urban areas, Cincinnati, Cleveland, Columbus, which is far more, can't really say dangerous, but they're a much higher risk than what we're seeing in our rural areas, such as what we have here. The governor on this Tuesday made it mandatory in 7 hotspot counties to wear the facial coverings.
Yes.
And so that's all an effort to limit the spread. And that leads to the confusion of if you're wearing the mask, are you protecting yourself or you're protecting others? Let's address that.
Okay. Yes. So the governor's people have come up with levels for each county. So instead of doing a blanket-wide law changes across the entire state, they go by county. And so those counties have 4 different levels, basically from low to very high. And, based off of the information that he received, he issued, kind of like I said, a mandatory face covering for those 7 counties. The issue of face coverings or masks has been very controversial, especially since the beginning. Initially, there was, because there was a shortage, there was an interruption of the supply chain, and so the hospitals could not get the protective equipment they wanted. Then there was, I think initially CDC was kind of against facial coverings, and then they were for facial coverings. A lot of that was basically to preserve that protective equipment for those frontline workers that would be seeing the highest number of people that actually had the coronavirus. So we wanted to protect those individuals. As it's going on, it does appear that the facial coverings do provide a certain level of protection for the individual, but more importantly, they stop the spread of the virus to other people. At this moment in time, like I said, we're finding that the COVID virus is a droplet virus, and what that means is that the virus attaches to droplets. So every time you speak, you sneeze, you cough, you actually have droplets. You really can't see them, but they're droplets of basically saliva and liquids that are coming from the lungs. And the virus is in those, and that's how it spreads to other individuals. So with the use of these face masks, and that's one of the reasons why there was the surgical face mask versus the N95 face mask. The use of these type of masks is to catch the droplets. So the virus itself is super small. So if it was like an airborne thing, it would go through this. But the virus attaches to the droplets, and so the droplets are caught by this face mask, and so therefore it's kind of protecting other people. And so this is the reason for the mandating of face masks, especially within buildings, because that's where you're going to be close to other individuals. That if you cough, sneeze, or even honestly if you're laughing or just talking, you're also releasing this virus. But if you have this, you kind of capture it, and it keeps it from infecting other individuals. So that's where that thought process comes from.
I don't want to get into the politics of it all, but I know that with these types of restrictions that have been placed, so many critics have been, where was that during the riot activity that started out and all? Uh-huh. And the reason I say that is it just seems to confuse it even more. Mm-hmm. But you can't control everybody at all times, can you?
Exactly. And you're exactly right. So when it came to the riots, or I guess let's separate. So the protest, yes. Exactly. Now the riots are totally different. We're going to take that one off the table.
And forgive me, I should have said the protest instead. Yeah.
But so when it came to the protest, if you actually look out there, quite a few of those individuals actually had masks on. And what they're finding now is, as we're getting information from the contact tracing, the prevailing thought, I'll put it that way, is that they're not seeing a lot of cases coming from the protest. And it seems to be coming from other social events and things of this nature. And at least from what I'm gathering, granted this information will, like everything else, will probably evolve, is that it looks like this face mask really is keeping individuals from spreading this virus. Mm-hmm. And I think that this has a lot of implications, in terms of, schools, because schools are coming up now, where you will have a large number of individuals close together for long periods of time. And if we find that truly, if we kind of confirm that the virus really did not spread much in these extremely large protests, and the only difference is that these individuals had a lot of, like I said, maybe it's not 100%, but maybe it's like 80% of the people wore the mask, then we can feel fairly comfortable that we can, go to school or a lot of other activities as long as individuals are willing to wear this mask.
Makes a big difference.
It makes a big difference.
In fact, the governor, when he addressed this issue, placing the order into effect, said if 75 to 80% of Ohioans would wear the face coverings, we could give this virus a severe blow.
Yes. Yes, there have been studies that, or estimates that they think that 80% is the magic number. If you can get 80% of the people to wear the mask, that the virus numbers will drop down significantly. Because if we really think about it, if there's an individual that's in a room, say it's maybe a party or something of that nature, and that one individual has that mask and everybody else has a mask, it can't go anywhere. You bring the virus with you, you take the virus with you, and you don't spread it to other individuals. And because that's how this thing really spreads. It's like, crowded areas, especially indoors, and it spreads through those droplets. And this seems to be, or at least right now, from what I'm seeing, this really seems to be the magic trick, at least until we get like a vaccine or a treatment of some sort.
And we're seeing that from these hot spots here in Ohio. According to the health commissioners who spoke with the governor, they were saying that they started to see certain names pop up, and it appeared that it became more family related, which were probably family gatherings as graduations came along, birthday parties, that sort of thing. And then you jump into the church activities, everyone slowly getting back into it. It's inevitable we're going to see more cases, but we have to do what we can to wear the mask to make that a lower number.
Exactly, because I think that's the thing that we want to do kind of like you said, is that you want to slow this spread down. And I know, speaking of controversies, everyone wants to compare this to the flu. But as an individual who I've treated people who've had COVID-19, I have friends, other physicians, friends who've treated individuals with COVID-19. This is not a virus that you want to catch, and you definitely don't want to spread. And one of the concerns is that for individuals, say it's a 20-year-old, most of those are fairly asymptomatic or mild symptoms. The concern is not that individual. Although don't get me wrong, every now and then, like I said, even those individuals will wind up either in the hospital or every now and then they do pass away. But the concern is whenever you take that back to grandma, granddad, your great aunt or something of that nature. And like I said, those individuals do not do well with this virus at all. And so that's one of the reasons why we really want to get everybody in the habit of wearing this mask. Take one, put it in your pocket. Do you need it at the gas station? No. But, if you go in there to pay for your gas or pick up some gum, you want to put that mask on when you walk in there, and that's to, prevent that from spreading to someone else.
Let's move then to testing if we could.
Yes.
Because early on, there wasn't a lot of test supplies available. They were trying to hold things back for the potential surge.
Yes.
Then it became, we'll test you if you have a lot of symptoms. Mm-hmm. And now it seems as though there's a point where so many people are getting tested that don't seem to have symptoms,
right.
or because they're just, how do I know I'm a carrier?
Okay,
exactly. You really don't know, do you?
Correct. You're absolutely correct. So the testing has really evolved. Kind of like you said, initially it was like, very stringent criteria. You had to check all these boxes in order to get a test. And now sometimes they even have these little pop-up testing places where you just kind of, you just get in line and they're just going to swab you. And like I said, a lot of people, yet again, I've known some people that, say that they were going to, yet again, visit grandma. They know that they've either been in some activities that where COVID might spread, or they work in high risk job occupations. So like I said, say if you're a physician, and some of those individuals will go, even though they don't have symptoms, and get tested to make sure they don't have COVID before they go see other people. And then some people it's just for them, it's just reassurance. So they want to go see if they have this and kind of go from there. So that is the evolution of testing here in the U.S., so that we are testing a lot of people. In addition to this, they're also, like the governor is going around now and with the National Guard, helping the National Guard, also testing, individuals at nursing homes. So a lot of the staff in nursing homes, just to kind of get an idea, like I said, if yet again, are the individuals that are asymptomatic carriers of this particular virus? Because that's something you don't want to do, is have that individual, working in a high risk, a place where the individuals are at high risk, the patients are at high risk, and they just don't know that they have that virus.
I know that times when We go around looking for flu shots.
Okay.
You can go and sometimes they'll be free, other times there'll be a $25 charge, bring your insurance card with you, all that. And I know that's also led to some confusion in regards to the testing for this. Some places it's free, other places there's a charge for it. And that's because private companies are getting involved?
Yeah, so I think that what's happening now is that you're getting a lot of different companies involved. My understanding, at least, has always been that, at least for people that have insurance, or even with some of these testing sites, even without insurance, they weren't supposed to be charged a copay, and it really wasn't supposed to be a charge to the patient. However, once you get into the private realm, the rules change. Different companies will have different motives. Some are altruistic; they just want to, kind of help the community. Others have more of a profit motive. So I would say that whenever you're going to these pop-up clinics, just make sure you ask in advance, hey, am I going to have any out-of-pocket costs? Just to make sure that you understand, because some people may say if it's $50, they may just want to pay it just to get it done. Maybe it's more convenient or faster. But a lot of other people will be like, nah, if there's a fee, I don't want to pay for this. So make sure you ask for that ahead of time before allowing people to get your information. So,
as we are talking and doing this on July 7th, last week there was a pop-up testing center in Circleville at the Pickaway County Health District. Do we project to see one coming here soon?
So we're actually in the process of looking into that. Like I said, we're actually doing a little bit of research to find out how to get that done, especially to be done without a cost to the individuals. Kind of like we said, as we start looking through this, like I said, different testing companies operate in a different manner. Some of them will come out to test, and they will use some insurance, some cash pay, whereas some of them are more of contractual testing labs, so that the organization, say the health district, would have to pay the fee before they would come. And so with that, we're trying to find out what's the best way to provide that testing to the residents of Ross County. So more to come.
So the testing has been done. We've had 130 cases here in Ross County so far. Last week, the reporting of presumed recoveries started coming out, putting into the state numbers. And when you do the mathematics on this, you take a look at, okay, this total cases, this amount of recoveries, well, there's that gap in between. Those must be active or still yet to be determined as to what status they are, positive or negative. Is that helpful information for us right now?
So I think it's a curious thing to track. However, you have to remember, like I said, this is individuals reporting their symptoms, and then in terms of our total number, we get the report for anyone that is a resident of Ross County, whether they're tested in Ross County or not. So even if you're in Columbus, Cincinnati, another state, like I said, those numbers come back to us. So we may not know when that individual has completely recovered, especially if not everyone is cooperative with our contact tracers. So the ones that are cooperative, of course, we track them. They monitor the fevers and everything until the symptoms are resolved. But if they're not as cooperative, we won't have that information, or at least it won't be as accurate, because we'll just kind of guess through the 14 days. Yeah. So,
and that brings me to what I was going to ask about contact tracing. What have we learned about the contact tracing since it has started, and has everybody been cooperative, or have some been kind of? Because I got to think that would hamper the contact tracing procedure.
Yeah, so the contact tracing has gotten more difficult. So initially, of course, we were in a lockdown situation. So people, for the most part, were at home unless they were essential workers, maybe going to a grocery store. So I think for talking to nurses, it was a lot easier for the contact tracers at that point in time, because say that you were at a dinner, you kind of know where you've been. You can't go to the bar. And so there are no really large public gatherings. As the state opens, then contact tracing becomes a little more difficult, because if you're at, a store that you may not have been at before, like I said, that store has employees, there are other people that are coming through and things of this nature that can make that a little more cumbersome as time goes on. And then also we have noticed that as time has gone on, people are not as cooperative with answering the questions. And continuing to monitor their symptoms, or to let you know who they're being exposed to. And I imagine that's a combination of, I don't know if it's just the time that's going on. The other thing that we're seeing is that younger people are becoming positive. And, younger folks have a tendency to not be as cooperative with authority, perceived authority figures in the first place. So I think you got a lot of things going on that where contact tracing is going to become at least a little bit more difficult as time goes on, both because of just the logistics of individuals being in different places and having to remember where they were. So like I said, if say you became symptomatic on day 5, you've got to remember where you've been on the last 5 days. So did you go to a birthday party? Did you go to a 4th of July cookout? Did you, were you at work? So you have all those things going on there that are going to complicate that. And then, like I said, if you have individuals that don't provide the information, that also makes things difficult. So I think that's going to be, an area of concern, or at least it's going to be an area of difficulty as time goes on. But I think at the end of the day, like I said, hopefully the majority of people will cooperate so that we can track this virus down and, like I said, warn people that may have potentially been exposed.
Yeah, because we all don't keep a journal.
Right, exactly.
It would be helpful, wouldn't it?
It would.
Is there anything that we have not touched on that you wanted to address today?
Overall, I think we've had some very good questions. Hopefully we've provided a lot of good information for your listeners. I do want to go back to the mask issue, because this thing is just so controversial. In terms of the mask, we have, I would say, 3 main different types of masks. There's the N95 mask, which, those are the type that protect you. So like I said, they're, it's hard, granted, it's a little harder to breathe in them, but, they're designed to keep, airborne particles from getting to you. And for the most part, most people will not need those unless you go into a high risk area or something of that nature. Then you have surgical mask, which is what I have right here, which is a simple mask. We as a physician, I wear them in the hospital. We've been wearing them since this thing started. They're highly effective, and usually the costs were pretty high for a while. The costs are really coming down. Easy to take this, throw it in your pocket, kind of carry it with you. And then you have the more popular cloth masks that a lot of people have been making. They should be in 3 layers. And for the most part, like I said, they are a little less effective than this, but they're better than nothing. And for those individuals, I know that a lot of people that, kind of question the virus, and I know that information has been changing so much. I do understand that information has been changing so much, but, you're really kind of seeing science live, which is not what people are used to. In the meantime, this is a contagion, which is almost like catching Russian roulette when you get it. I mean, depending upon your age, for the younger people, most of them are going to be fine, but you don't want to take this to your older folks, because as you get older, especially the 65 and older, or individuals with comorbidities, their risk of being hospitalized or dying for this, goes up tremendously. So that you really want to be really a good citizen about this. And, and just wear this mask. I mean, I know some people think it's inconvenient. I've heard people saying that they can't breathe and their oxygen goes down. Your oxygen level does not go down. Your oxygen level does not go down. I wear this all day. Your oxygen level does not go down. Now, sometimes it does. Like I said, it will get stuck on the nose. So you have to adjust it a little bit. But otherwise, it's a mild inconvenience. That can really can save a life. It can save a life. It can decrease the numbers. And for the most part, you can do this with most of your activities, with the exception of eating and drinking. you can do this. If you go to a restaurant, you eat, and like I said, when the waitress comes up, put your mask on so you don't spread anything to the waitress or the waiter. Like I said, if you go into an activity, like I said, if you go into an activity, you can put this on. You can talk. You can actually talk through this. I mean, I can put this on for the rest of this. Okay. So yeah. So even with this, you do have to project a little bit more when you have this on, but you can project. And like I said, right now, with us, like I said, with what we're seeing from the protest and the use of these masks, if we truly confirm that this virus did not spread during this time, like I said, this is going to be our most useful element. And in addition to this, like I said, especially with us probably doing this during school time, you won't just decrease COVID, but the regular flu. This is what we use to protect from the regular flu. Mm-hmm. So we could possibly decrease 2 viruses at one time if we all get this together and use this at the same time. So,
and if anything, we've learned that wearing the mask, you communicate with your eyes.
Yes, you do. A lot.
Yeah, you probably are used to being a doctor and wearing these on a regular basis, but for those of us that are novices, I only have the initials DR. I'm not a doctor. So thank you again for being so open with us and helping try and answer some of these questions that have built up over the last few weeks. Okay. And we hope we have a safe future as school opens up before too long. And so we appreciate your guidance. With Dr. Chris Brown, I'm Dan Ramey. Thanks for watching Letter Media.